Hi class, it's Dr. Lindner. In this next video, we're going to be looking at just the heart. We have this model here. It's called a brown heart. And it's really important to remember that when we're looking at the heart, we have to know that what's on our reading left is typically, when we're looking inside the heart at the back, it's typically the right side. Okay. So this is the right side, whereas this part is the left side. But keep in mind, when we take the top layer off like this, and we turn it around and we look inside, things can change. So I don't want you to be confused when you're looking at this part compared to the other side of the heart, right? Because we're taking, once we're looking at it from the front, and then we're going to take it and we're going to flip it this way. All right. So you really have to start thinking a little bit more functionally when we're looking at it. So when we look here at the first one, we've taken the top of the heart off. So this part is the individual's right side. This is the left side. Okay. So right here, let's just identify the chambers: right atrium, right ventricle, left atrium, left ventricle. Easy enough. If you ever get confused, just look at the thick muscle. The thick muscle on the ventricle side is always left. Compared to the musculature here, it's a little bit thinner because the left side is dealing with systemic circulation, whereas the right side is pulmonary. All right, now we've taken this, the top part, and we're flipping it around. Okay, so that's what this orientation is. So this side is the right atrium. This is the left atrium. That little reservoir chamber is the left auricle. Okay, that's going to be the left auricle. When we look at it from the outside, it's going to look like this. But when we flip it around, we kind of see a little reservoir here. Okay, so that is the left auricle, left atrium. Left ventricle, again, if you look at the thick myocardium, that's left, it's thinner on the right-hand side. What we can also see is the opening of the pulmonary semilunar valve. This right here is the pulmonary trunk, right? It's blue because it's carrying deoxygenated blood. So right atrium, left auricle, left ventricle, right ventricle, and the right ventricle is what's going to pump blood into the pulmonary trunk, into both right and left pulmonary arteries to drive deoxygenated blood into the lungs. So now orient ourselves, find the thick part of the heart. This is left ventricle, right ventricle. Left ventricle, when it contracts, is going to push blood into the aortic semilunar valve, into the aorta. So this is the ascending aorta. This is the arch of the aorta. When it starts to descend, it's the descending aorta. Okay. Off of the arch of the aorta is where we're going to find the right and left coronary arteries. This is the orifice of the right. This is the orifice of the left coronary artery. Here is the superior vena cava. The superior vena cava is going to bring blood in from the left and right brachiocephalic veins into the superior vena cava. From the superior vena cava, all the deoxygenated blood is dumped into the right atrium. This little green thing right here is the SA node. It's the sinoatrial node. It's the pacemaker of the heart. When I get to another slide, we'll show you the electrical conduction system that involves these white structures down here that we see hidden in the interventricular septum. Okay, looks like we've covered everything here. Let's look at the next one. Still the same view. Now we're looking at some of the valves. So between the right atrium and right ventricle is the tricuspid valve. between the left atrium and left ventricle is the bicuspid valve, also known as the mitral valve. When we look at the muscular portion in the ventricles, it's called trabecula carne. The muscular portion in the atrium is called pectinate muscles, but down in the bottom, it's called trabecula carne. Off of the trabecula carne, we have these hills. In yellow, they're called papillary muscles. Now, connecting from the papillary muscles to the valves are these tendinous cords. They're called chordae tendineae. See how it's spelled, chordae tendineae. Having good tension is important so that when the ventricles contract and push blood upwards, these valves don't invert and blood doesn't regurgitate back into the atriums. Okay, let's look at what we're seeing here. Still the same view, right atrium. What's opening up into the right atrium is not just the superior vena cava, and what we can't see down below would be the inferior vena cava, but the third opening is the coronary sinus. The coronary sinus is what we see when we're looking at the back of the heart, and it's going to bring blood into the right there, right into the right atrium. Okay, it's bringing all of the deoxygenated blood. It's bringing all the deoxygenated blood that was delivered to the heart muscles back into the right atrium, because we still need oxygen so that the heart has strength to contract, so it has energy. So this is the orifice or the opening to the coronary sinus. Here is the semilunar valve, the aortic semilunar valve. In the left atrium, we have openings, and what we have going into the left atrium are going to be the pulmonary veins. So going from the lungs, bringing oxygenated blood back into the left atrium, we have to have the orifices of the left pulmonary veins and then the orifices to the right pulmonary veins. Okay. Okay, what do we have here? We've already covered the tricuspid valve. Over here was the bicuspid valve. These are the chordae tendineae. Over here is the chordae tendineae. These are the papillary muscles on the right side and papillary muscles on the left side of the heart. Now, if we go back here on the top in green, that's the SA node. The sinoatrial node sends this electrical current and it goes to the AV node. After it sends it to the AV node, I think that's right here, the atrioventricular node, it's going to hide the electrical current in this interventricular septum. Remember, I said that when the ventricles contract, they contract inferior to superior. So we want the muscles to contract from inferior to superior. And the only way that happens is by hiding the electrical current till the messages can get down to the Purkinje fibers. So after the AV node, we have what's called the bundle of His, which is right here. And the bundle of His separates into a right bundle branch and a left bundle branch. This is a right bundle branch. This is a left bundle branch. Then the bundle branches come down and divide into these little fibers called Purkinje fibers. These little, you see it here in orange, Purkinje fibers. Purkinje fibers. Okay, so up here was the SA node. Right down here was the AV node. And here was the bundle of His, and you can see the beginning of the right bundle branch, left bundle branch. There's the orifice of the coronary sinus, tricuspid valve once again. We could see a little bit better the openings from the veins coming from the lungs into the heart. These are the orifices or the opening of the left pulmonary vein, the openings of the right pulmonary vein. This is the bicuspid valve, aka mitral valve. we could see the chordae tendineae attaching to the papillary muscles. All right, so again, up on top, number 73 looks like the sinoatrial node, and number 74, the atrioventricular node, or the AV node. So the SA node sends this electrical current to both right and left atrium so that all of the entire atrium contracts at the exact same time. But the SA node also relays it to the AV. The AV node relays it to the bundle of His. Let's see, here's the opening for the superior vena cava, right? Blood from the head and the arms are the deoxygenated blood is gonna come through the opening of the superior vena cava. Let's see what else we have here. Here's the opening of the coronary sinus. This is a fetal remnant. The fetal remnant is called the fossa ovalis. The fossa ovalis was an opening where blood can shunt back and forth during embryological development between both of these atria. But then when we're born, this thing closes, okay? And it's called the fossa ovali. Let me go back here. Here's the right atrium. Here's the opening of the coronary sinus. Again, that's where deoxygenated blood from the heart muscle itself pools back into the right atrium. Here's the ascending aorta. Here's the orifice for the right coronary artery, the opening or the orifice of the left coronary artery. Here's the left atrium, and we can see the orifices for the left pulmonary veins. Okay, this is only conduction, electrical conduction. When we do an EKG, we're measuring the electrical conduction system, right? The PQRST waves. So up here is the sinoatrial node. Here's the atrioventricular node, or the AV node. So we go from SA node to AV node. Here's the opening of the coronary sinus, the fossa ovali, the opening for the superior vena cava. After the impulse goes from SA to AV, it goes to the bundle of His, which we see right here. The bundle of His. The bundle of His divides into a right bundle branch and a left bundle branch. Both of those bundle branches go to the apex of the heart, where they divide into the Purkinje fibers. And now the ventricles get their electrical conduction message to contract from inferior to superior. When it contracts inferior to superior, that's what forces the AV valves shut, the tricuspid and the bicuspid, aka mitral. Without the chordae tendineae, the force of that contraction would push the valves that are like this into inversion, and blood could then regurgitate into the atrium, which we don't want. Okay, let's look at some of the blood vessels. Here we're looking at the posterior portion of the heart, so you have to be able to orient yourself. Once we see this huge dilated blue vein right here, this is the coronary sinus. So all of the blue veins, right, all of this deoxygenated blood is going to pool into the coronary sinus, and then it finds its way into the right atrium. So that little opening there, when we flip the heart around, we'll see that little opening in the depression of the right atrium. That's the opening of the orifice of the coronary sinus. Here's the right pulmonary vein, the right pulmonary artery. Here is the left branch of the pulmonary artery. Here's the left pulmonary veins. So these red pulmonary veins are going to divert blood, oxygenated blood, into the left atrium. Okay. From the posterior side, we have the posterior vein right here. Here's the middle cardiac vein. Here's the small cardiac vein. So here's the small cardiac vein, the middle cardiac vein. That middle cardiac vein follows along with the posterior interventricular artery, which is here. Here's the great cardiac vein. So great cardiac vein, posterior cardiac vein, middle cardiac vein, small cardiac vein, all of that pooling into the coronary sinus, which will bring blood into the right atrium. From the front of the heart, when we're looking at the front, here is the right auricle, right atrium. Here's the left auricle. Right here is the pulmonary trunk. And this is the right coronary artery. Here's the left coronary artery. Off of the right coronary artery, there's a branch called a marginal branch. This is the marginal branch. Off of the left coronary artery, there's a circumflex artery right here. This is called the circumflex artery. Off the left coronary, it follows down the interventricular sulcus. The interventricular sulcus is this depression between the right ventricle and left ventricle. This is called the left anterior descending or the left interventricular artery, either name, left anterior descending or left interventricular artery. Here is the great cardiac vein. So that great cardiac vein wraps around, the great cardiac vein wraps around to the posterior. You can see it right here. Okay, this coming around is the circumflex artery. So if we kind of look this way, if we go here, here's the circumflex artery and the great cardiac vein kind of move together around to the posterior portion. Okay, to the front of the heart right here, the blue one, this is the anterior cardiac vein. So there's an anterior cardiac vein, there was a posterior cardiac vein. Let's look at the posterior cardiac vein. Posterior cardiac vein is right here. Okay. Okay. What else do we have? Off the aortic arch, right here are the three valves of the trumpet. We have the brachiocephalic trunk, we have the left common carotid, and the left subclavian. This right here is the ascending aorta, arch of the aorta, descending aorta. Here is the pulmonary trunk, and then this is the left pulmonary artery. These are the left pulmonary veins. This is going to lead oxygenated blood into the left atrium. Okay, so what else do we have here? We have the ligamentum arteriosum. This is kind of similar to the fossa ovalis that we see in the right atrium that kind of shunts blood in between the right atrium and the right ventricle. Here we have the remnant of the connection between the aorta and the pulmonary trunk. And that remnant, it kind of closes off and it becomes this ligamentum arteriosum. Okay. Okay, let's see. Again, now we're kind of looking almost like from the inferior part of the heart. So right here is the inferior vena cava. That's going to divert blood into the right atrium. And here's the superior vena cava that also brings blood into the right atrium. Here are the pulmonary veins. Here are the pulmonary arteries. Here is your coronary sinus. And this is your left atrium, because we can see the opening for the pulmonary veins going inside there on the left side. And we see the pulmonary veins on the right side also bringing blood, oxygenated blood, into the left atrium. This is just the trachea. And the trachea will divide into a right and left primary bronchus. Okay, where it bifurcates is called a carina. Here is the pulmonary trunk. Here's the right auricle. This is the left auricle. Here is the deep muscle, and here's the superficial muscle of the left ventricle. deep muscle, superficial muscle of the left ventricle. This entire portion right here, this is the left ventricle. Here, this is the right ventricle. This is the right auricle, left auricle. From the inside, right here, this is the, again, find a thickened portion, which is right here. When we see the thickened portion, we know that this right here is the left ventricle. This side is the right ventricle. And we know that the right ventricle pumps blood into the pulmonary trunk, which is blue. It's deoxygenated blood. So if this is left ventricle, this is left atrium, this is the left auricle, that little reserve, that little chamber. On the left side, we have the bicuspid valve or mitral valve. On the right side, we have the tricuspid valve. We still have the pulmonary muscle, the chordae tendineae, trabecula carneae in both ventricles, papillary muscles in both ventricles, chordae tendineae in both ventricles. In the atrium, we have pectinate muscles. Pectinate means comb. It's like you took the teeth of a comb and stroked it along the sides of the atria.